Canada will open a new express permanent residency program for international doctors next year. The federal immigration minister says the program will be open to physicians in Canada on temporary work permits, including ER doctors, surgeons, family doctors, dermatologists, psychiatrists, and other specialists who have been working in relevant jobs for at least one of the past 3 years.
Many of these doctors are already treating patients in our communities. We cannot afford to lose them. These barriers we are removing today, and the measures we are putting in place to recruit and retain our doctors will have a significant impact on the lives of everyday Canadians and the services they will receive.
Doctors who qualify for express entry will be invited to apply in early 2026. The Canadian Medical Association says this is a step in the right direction, but more still needs to be done. Joining me now is Dr. Joss Reimer, former president of the CMA. Dr. Reimer, it's good to see you again. Thanks for being here.
Nice to see you. Thanks for having me.
So fast-tracking permanent residency for 5,000 doctors, but doctors who are already here and already working. So what does this do for the doctor shortage across the country?
Well, when we're talking about the doctor shortage, we always need to be thinking about recruitment, training, but also retention, because we are hearing from doctors about the levels of burnout they're experiencing, about how they want to cut down their hours or seek out other employment altogether. And when we heard from doctors who are internationally trained and here on temporary work permits, one of the things we heard from them that was a struggle was any sort of path to permanent residency. So if we really do want to retain the doctors already here, we need to listen to them and make sure that we're providing them with the services that they need to be able to keep providing services to Canadians. And that's why we say this is a step in the right direction.
Okay, but how big of a step? Like obviously 5,000 doctors able to stay is better than no doctors able to stay, right? But is it holding serve or just limiting erosion, or does it actually build capacity?
I think we'll see a little bit of building of capacity just because this will help Canada be a place that people trust is going to be supportive of physicians who want to work and contribute to the system. But also, I think it's fair to say that it's also part of a holding of what we have now, because as we see Canadians aging, that includes physicians. So we're going to see more retirements, and anything we can do to hold while also building is really important. But I don't think this alone will solve the problem.
No.
Even if we did manage to get all 5,000, we're 23,000 family physicians short in this country. So we need to be doing a lot of other things at the same time, even if this is a good step.
Okay, but there are more than 5,000 foreign trained and foreign citizen doctors working in Canada right now. So what do you make of the number the government has chosen here? I'm not sure the rationale of why 5,000, why not 6, why not 7, why not 8? I mean, is there an argument for this to be a larger cohort of fast-tracked physicians, or is this where you think it needs to be?
Yeah, and I don't have the inside information about how they chose the number, but we do know that best estimates are that there's probably around 13,000 physicians in Canada who are not working as physicians. So there's certainly a group there that could be contributing to the healthcare system. And if we can get them in through this path or other paths, that could be incredibly helpful as we try to address this issue. So maybe this will be incredibly successful and the government will want to expand it. That's something that, we'll have to wait and see. But what we really do want to see is any step in the right direction. So I will take the 5,000 happily and hope that we continue to build on that, and that physicians are still eligible through other immigration pathways as well. They're not limited to the 5,000.
Right. So, but these 5,000 would not have the credential issues that the 13,000 you mentioned have, because they're practicing in some form in the country, right? The 13,000 internationally trained physicians who are not working in their field. The issue there is licensing and accreditation, which is the provincial colleges and provincial governments, and that's where a lot of the bottleneck is, rather than immigration, correct? I mean, what do you need to see there to help unlock that capacity?
Yeah, it's really tricky to try to do the licensing because medical training isn't the same all across the world. And we want to make sure that Canadians get really high quality care and predictable care when they're going to see a doctor. And so I don't envy the work that the colleges have to do in trying to understand what somebody's expertise might be. But that said, we do want to make sure that everyone who can contribute to the system is able to do so. So even if their training is a little bit different, they may still have a really important role that they could play if we can create an individual assessment of what their needs needs are. But that takes time and that takes money. And so we'd love to see more support from provincial, territorial, and the federal government to help us do those assessments. There's a clinic that's been going for not even maybe around a year in Nova Scotia, where they're bringing people through, and the whole clinic's purpose is to assess internationally trained physicians over a 3-month period while providing care to patients. And if we could have funding for clinics like that across the country, that would be an amazing opportunity to both increase care that's being provided while also assessing those physicians and they're functioning under supervision and getting that assessment done so that hopefully they can then go out and join the workforce.
So on that, that's interesting, right? Because I've a good friend who's a doctor who teaches in a medical school back home and talked to me about this, that, a German medical school versus, say, in Turkey, there's different standards, different teaching, and you can't just pluck them and drop them into the Canadian system and have them hit the ground running. So this program in Nova Scotia, I mean, is this something that can scale and be done in different jurisdictions? And is the role for the federal government money on something like that, or how could that grow from there?
Yeah, I think it is something that could scale, and we're still waiting to see numbers and results because it's a fairly new program. So I don't have anything that can say like this is the absolute solution, but it has so much promise. I'm really encouraged by the ingenuity that we saw putting that together, and I think it's a really feasible solution. But we do need to be able to have the clinic staff, the physical space, all of that put together, and the ability to fund the physicians who are supervising also, because they won't necessarily be doing their usual visits of patients and getting funded that way. So the federal government could absolutely provide funding for something like that. The provinces and territories could also do that. And I think it's one example of great ingenuity, great resourcefulness in trying to solve a problem of people who are here, who want to contribute, but we need to figure out exactly how they can contribute.
Right. So we like to talk about the Canadian healthcare system, but really we have like 13 healthcare systems, right? The 10 provinces, the 3 territories, different licensings, different administration. I mean, that's the nature of the country. I know there has been a lot of talk on harmonizing, say, truck driver regulations and welder regulations so that trades people and journey people can move more readily across the country. Is there any progress being made on the idea of harmonizing it on the medical licensing? Because you don't necessarily want to race to the bottom, but you would like the ability to have a greater free flow of professionals, and it seems like that is a key step to unlocking, for example, the foreign trained doctor potential.
Yeah, no, we would love to see more ability for physicians to move around the country. And we have an encouraging start in the Atlantic provinces. So not that long ago, those premiers came together and said, we want the physicians in these 4 provinces to be able to move around. And so for $500, they can get a license in all 4 provinces and then help out wherever help is needed. And I'd love to see something similar to that, learning from what their challenges were and make it even better so that, if there's a physician working in Calgary, but they hear that in northern BC, they're going to have to shut their ER down if they don't get a physician for the weekend, that they could just go and help and cover that weekend. Because right now you'd have to apply for a license, you'd have to pay for that license. It's a whole complex process. And so we'd love to see some mechanism to have mobility of physicians across the country addressing the needs when they're there.
Right. The locums, those are happening certainly in rural and remote areas. We're seeing a rise in costs in provincial systems with travel nurses as people check out of the system to get the higher pay of the travel nurse opportunity. So 5,000 fast track doesn't solve the problem, but it certainly doesn't exacerbate the problem. What's the next step you'd like to see as a final point from the federal government to help push us towards a more robustly staffed medical system?
There's a lot of things that we want them to be working on. Some of the things the federal government particularly could play a major role in is helping us with administrative burden. So, for example, there was a bill that was introduced before Parliament was prorogued that would have allowed us to have more interconnectivity between our health systems. Because right now, if I'm in the hospital, I can't see what happened in the clinic or in another province or even another hospital. And so there was a bill that we really liked and hope that it gets reintroduced to help us get better information so we can be more efficient, make fewer errors, know the allergies, the previous medications, everything that our patients have had. But there's many other examples. We'd like to see some funding that goes towards team-based care, some creativity about how we can bring in social workers, occupational therapists, counselors into that primary care space so that together we can provide more fulsome care to people and not just expect the family doctor to be everything to everyone.
Yeah.
There's many wonderful ideas, but we are still today celebrating to at least have taken one positive step.
Yeah, that electronic patient record and data sharing thing, that could speed up a lot of things and a lot of efficiencies, but it's expensive to get going. Dr. Joss Reimer, there's lots more we could talk about. We're out of time. Thank you so much, former president of the Canadian Medical Association.